Hello and welcome. My name is Dr. Gray, and I am from Black and White Neurology and Behavior. I appreciate you joining me today. I apologize for not being able to come meet you as I am across the country from where you are, but this is easily done via webcam, and we can make my official diagnosis as well as have sort of a therapy session for yourself as we do this examination. Now, I actually highly prefer that you are either laying down relaxing, either in bed or on a couch, or even just some sort of meditative state where you can have some quiet and we can do this together thoroughly. The best way for me to make my diagnosis, as well as you get the therapeutic session that you're looking for, is for you to be in the most comfortable setting that you could possibly imagine. So, to start, we're going to take some notes. So to start off, I'm just going to officially have you tell me and spell your name. Okay. 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 Thank you very much. It's very nice to meet you. Now, we're going to start off with a good phone number so that my nurses can contact you. I have to say that even though I may make a diagnosis here with you tonight, I do have an official report that I write, and then I have one of my nurses either call you or email you to let you know what your official diagnosis will be tonight, okay? So a good cell phone or home phone number for you? And let's just take down an email address as well. Okay, that sounds good. All right, so we're going to get started here. Now, you are feeling relaxed. You are in a relaxed state. Then we can start. Good. Okay. So the first thing I want to do is I want to take down your chief complaint. This chief complaint is the reason you basically came to us. Now, there may be multiple, but things I'm looking for are things like headaches or nausea or stuff like that that you may be going through. So basically some symptoms, but the symptom I want is the one that first started with and one that may be causing you the most trouble. That is the chief complaint. Okay. So you've had headaches now, okay. And how long have you been having these types of headaches? Okay. Good. And these headaches, where exactly are they located? Are they located behind the eyes, on the top, by the temple, or in the back of the head? Okay, very good. So behind the eyes, especially? Okay. Okay, now, symptoms that may be going along with this. Have you been feeling nauseous lately? No, not nauseous. Okay, well, that's good. How about feeling tired, fatigued? Yeah, tired. Okay, very tired. Any other symptoms that you can think of that may be a side effect to what is going on? Some anxiety. You've been having some anxiety. Okay, so we'll write that down as well. Anxiety. And that kind of makes sense. The headaches can often be one of the most severe types of symptoms for a patient to be going through, because the brain is the most powerful organ in the body. It controls your heart. It controls every move that you make. It controls everything. Even the hormones that are sent throughout your body, a lot of are started right up here. And we just have to make sure that we can clear here first, and a lot of the symptoms go away down below. So the anxiety, I know you aren't feeling nauseous, but oftentimes we do have patients who feel nauseous with eye pain or headaches behind the eyes. And other symptoms that you may be going through can be fixed just by clearing your headaches. So that's going to be our main focus here tonight, and that is my specialty. It's why I'm here in neurology and behavior. So that is my goal tonight, is to try to help you go to sleep and eventually get rid of those headaches. Okay, just reading back on my notes here a little bit before we get started with some exams. I apologize. I like to tap on things. It helps me think. I hope you don't mind. Yeah, okay. So let's get started. Now, I want to tell you that this examination can be done with you awake or asleep. I know it sounds a little weird, but it is actually possible. So eyes closed or open at this moment is totally okay. I can get a closer look, and we'll see what's going on. Okay. So I'm just going to get a closer look here. Good, I see that you're closing your eyes a little bit. That's okay. All right. Just going to write down a few things here. Okay. So, I'm going to shut the lights off here on my side. I'm going to make it a little bit dimmer. And we're going to do some eye triggers here. We're going to see if we can really bring out what might be going on right behind your eyes. You're not going to feel a thing. This isn't going to hurt or bring out any headaches or anything like that. So what I want you to do here, I've got a light with me. And whether your eyes are open or closed, if your eyes are open, do your best to follow the light. If your eyes are closed, there should be a little bit of light that seeps through the eyelids while they're closed. Just try to focus a little bit on that for me. So we're going to get started. Here we go. Good. Good. Very good. Okay. That's good. Okay, now we're going to get a closer look with the light here. Good. Okay. Yep, just look right into it. That's fine. Excellent, you're doing great. Okay. Once again, just going to take down a few notes. Yep. Eyes 20. Okay. So I'm going to turn the lights back on here for a second. Excellent. that we've done that, I'm going to take another closer look here. Good. So I can definitely see the reason for the headaches there right behind your eyes. It seems as though you've been having a little bit of strain back there. And this strain, although it is only mental, is like a weight sitting on the nerves of your optic nerve. And this can definitely cause the headaches that you're having, can cause the blurriness and things of such. And the anxiety might just be coming from the fact that not only is it the strain, but you're also being very stressed, from what I can see. And I think that you just need a little bit more time for yourself, to be honest with you, just a little bit, something to keep, easy on the eyes and be nice and relaxed. So, I'm going to write down some things here. Okay, now the eyes are surrounded by muscle, and that is what helps control the eyes. One thing that you may not know is those who have a lazy eye usually have some sort of chemical synapse that is not working as well on the outsides of the eyes, which causes the eye to sort of creep towards that side, and that thus being a lazy eye. And a lot of times, a therapeutic thing that you can do is when you wake up in the morning, especially when you haven't used your eyes for a little bit, you do some corner looks, I call them. And you just try to pick 4 points, left and right, and you focus on them. And this will help stretch out the muscles around the eye and can actually help you focus throughout the day. And it's just a very simple activity that if you do every morning, it can help with those headaches for sure. Very good, very good. I see that you're closing your eyes and possibly falling asleep. Again, that is perfectly okay. Okay. So we're going to move on here a little bit. Now what we're going to do is we're going to work on a little bit of audio. You told me that you're having a little bit of trouble with some of the temporal headaches. So my microphone here that I have is 3D. So if I go on this side, you can hear me over here. If I go on this side, you can hear me a little better over here. And I've got just a simple pair of scissors, and they make somewhat of a metallic, little clicky sound, and that will help trigger the auditory muscles inside of your ear to see if we can't work those out and see what's going on over there. So good. It's very subtle, but I do see those ears slightly moving as I do this. Excellent. You're doing great. Okay. Good. Now, I must ask, are you around, or is your job, or even at home, are you around loud noises for quite a while? Okay. So, again, one of the things that may help you in this case is to recognize that you are around this type of noise for a while and try to get it so that you're in a relaxive state, such as now, so that these muscles can, and this part of your brain, I should say, can relax as well. The brain's like anything else. If it's being constantly used, it can drain itself and eventually become tired. If you were to sit there with a weight in your hand and just keep lifting that weight, eventually your muscle is going to hurt and get tired. This is the same with the brain. So you just have to give yourself some time. You seem like a very hard worker, and I very much commend that. But just give yourself a little more time. And when we come back to these tests, I'm sure I will see much better results if you're able to successfully do this for yourself. Good. We're going to do a little bit of a therapeutic session now. I'm going to tap on my fingers and I'm going to rub the fingers together to help relax those ear muscles and soothe the brain a little bit. And as I said before, it's okay to fall asleep. It's okay to be with your eyes closed. That is the goal. Good, you're doing very good. Excellent. Okay. I'm just going to take down a few more notes. You're feeling better. That's good to hear. Now, another thing I can tell you is that there are these online therapeutic sessions such as mine that you can go to. And there's what I like to call ASMR. And it's an auditory sensory meridian response. And it actually helps with the brain. What happens is the noises that you hear can become so soothing that the brain has a sort of a overload and releases energy down the back of your spine all in one shot, and it's very therapeutic. It actually feels quite good. And I just want to reference one channel in specifically that I use with myself here. It's called Black and White ASMR. You can go on and just comment and like. And this may be able to soothe you in your future therapeutic sessions. Good. So I'm just going to write that down for the nurses to write for you. Excellent. All right, now what I'm going to do are a few more visual triggers for yourself. This is going to be all movement of my hands towards the camera, things of such like that. And this is just therapeutic so that we can try to get you to relax and possibly fall asleep. tests for you. I think my official diagnosis for you is that you're just having traumatic headaches, as I call them, or strenuous headaches, or tension headaches. These types of headaches are common with those who are going through a bit of a tough time or just going through a lot of stress. The rest of your symptoms should clear up if we can get rid of the headaches that you're having. It's definitely a reason to call because I get that it's a burden on life to have to go through these types of things. So I appreciate you coming to me and going through this. You just never know what really might cause these types of symptoms. So it's always good to be told by a doctor what's going on. So I've gathered all my notes. I'm going to reiterate them to myself and just make sure that everything makes sense. And I will send them over to the nurse, who will then give you an email or a call just to give you your final report. I much appreciate you coming to me via webcam. I am more than happy to do this for you. And again, my name is Dr. Gray from Black and White Neurology and Behavior. I appreciate that you came to me. Do you have any other questions for me before we go? Good. Good, you're very welcome. Yes, you're very welcome. What's that? You want me to do a little more? Okay, sure. I'll do a little more tapping for you. Good. Now, before you go off to sleep, we're going to do one last thing. I just need to schedule an appointment with you. I've got my appointment book here. I'd like to be back in about 3 months. I'll give you 3 months to try to go through some of these therapeutic sessions that I've told you about. And in 3 months, I'm hoping that you'll be doing a lot better. Okay? So let's plan for the 1st of May. Okay, I've got it written down in my book here. And to help you go to sleep, I'm going to finish with some of those hand sounds that I was doing. And I may even tap on a few objects as well. At this time, I would love for you to close your eyes. I'm going to turn the lights off here. And I'm going to hope that you can go to sleep. It was very nice to meet you, and I'll see you